Here, Toby, come here. You want to sit by Mama? March of '03 is exactly the time when I started having those symptoms when I was on a trip. I was with 3 other 50-year-old women, and I couldn't keep up with them. I was in a lot of pain. I was exhausted. I couldn't really do too much. I went to see Dr. Pressburg. He knew right away that I had something called pulmonary hypertension. And as a nurse, I knew what it was, but I also knew it was a really nasty, evil disease. And the survival was not good. And that began this journey that I continue to be on. They said to me, we think you have something called sine scleroderma. That is the actual underlying cause of the pulmonary hypertension. Part of me was, oh, thank goodness, we have a name to this, we'll have a treatment plan. And then part of me was like, oh my God, no, this is really bad news.
We kind of did some research, and she filled me in on the points that I needed to be filled in on, and knew it was not one disease by itself was tough, but to have all 3 together was really a tough pill to swallow.
I thought I'd walk out with an inhaler, and instead I walked out with a prescription for oxygen, and I needed to be on it 24/7.
Her life started out wide, and every year and every other year things would get smaller and smaller and smaller because there's less things she could do.
The last 10.5 years has been really difficult. I came with oxygen tanks, I came with equipment, I came with lots of medicine, and yet my friends were there the whole time.
I could see her slowing down, but I didn't want to believe it. We went shopping in the fall. She could not get from the car into the store. And that was the day that I went home and I cried.
She had beat the odds already. Somebody with the diseases that she had when she was first diagnosed 12 years ago probably had a life expectancy of about 4 to 5 years.
She was on multiple treatments to treat the pulmonary hypertension. Unfortunately, the last time that we met, it was clear that her clinical condition was deteriorating and was beginning to go on a very steep downward slope.
We talked about transplant, and she said, absolutely, now is the time.
Lynn was brought to the selection committee, and we were able to move forward and process through the United Network of Organ Sharing and list Lynn.
We talked about Froedtert, and they had not really done a lot of work with scleroderma patients. But in my heart of hearts, I kept on wanting to be at Froedtert. That's where my team was. One of the transplant coordinators called me and said, Lynn, we have lungs. And then so it began, a whole new chapter, a whole new journey.
Breath in and out. Okay, again. All right, your heart and your lungs sound great. Her lung function tests are really quite normal. We have some patients here who are out from transplant 20 years now, and so we're hoping, you know, that she's going to be among that happy group.
What do you enjoy now doing that you hadn't been able to do again?
Oh my gosh, getting up in the morning.
Getting up in the morning,
and
right?
just thinking, is this real?
Today, she's like a totally new person. The fact that she's the first person with scleroderma who got their lung transplant here means that my next patient, I'm going to be able to convince them that we can do it again.
Every time you talk with a patient, it makes a difference. And those nurses exemplified that. And there are so many that just made a difference for me.
And how are you doing with the breathing?
Good. Oh, it's going so well.
Still do. And I took care of Lynn for 5 years, watched her slowly decline, and thankfully and luckily she got lungs and is doing quite well.
My breathing tests, I need to continue to use, and my daughters tell me it sounds like somebody from Jurassic Park. I still can't believe I wake up every morning and the first thing I do, I go is, oh, yes. There's a wonderful quote from a book, and it goes, what made it bearable, of course, were the friendships. Through the help of my family, the girls, Pat, my friends, who I affectionately call Team Lynn, having those people here for me, not just the last 4 months, but over the last 10.5 years, made all the difference in my life.
She is enjoying life exponentially from where she was 12 years ago.
She's never let her disease define her. She's always been incredibly independent.
Nancy used to tease Lynn all the time that if Lynn would say something that Nancy didn't like, she was going to pinch her oxygen.
These bracelets are very meaningful to me because they're very symbolic of going through all of this experience. And I wear it in honor of my donor. What keeps me going every morning, every night, is thinking about her, that by giving the greatest gift, someone else would be able to live a full life. And I am.